Every 40 seconds, someone in the United States has a stroke. Every 3 minutes and 14 seconds, someone dies from one. And the most devastating part, for most of those people, their body was sending warning signals hours, sometimes days, before it happened. Signals they felt, signals they noticed, and signals they ignored because nobody ever told them what those signals meant. Today I am going to show you the 5 warning signs of a stroke that appear before it strikes, and the one action in the first 60 minutes that determines whether a stroke victim survives with full recovery or spends the rest of their life unable to walk, talk, or care for themselves. Sign number 3 happens to millions of people and every single one of them dismisses it. Do not make that mistake. Every 40 seconds another American experiences a stroke, and 7.8 million Americans are currently living with the permanent damage one left behind. A stroke happens when blood supply to part of your brain is suddenly cut off. Brain cells begin dying within minutes, and unlike almost every other cell in your body, brain cells do not regenerate. Every minute a stroke goes untreated, nearly 2 million brain cells die permanently. The damage is instant. The disability is forever. But here is what changes everything: strokes do not always arrive without warning. Your brain, starved of blood, sends distress signals before the main event. Most people feel them. Almost nobody recognizes them. Warning sign number 1: a sudden, severe headache unlike any you have ever had before. Doctors call this a thunderclap headache, and it is exactly what it sounds like. Not a tension headache, not a migraine you have had before. This is an explosion of pain, the worst headache of your life, that reaches maximum intensity within seconds. It happens because a blood vessel in or around your brain is bleeding or about to rupture. Many stroke patients describe it as feeling like something burst inside their head. If you or someone near you says those exact words, "the worst headache of my life," call 911 immediately. Do not wait to see if it gets better. Do not take a painkiller and lie down. Call 911. Warning sign number 2: sudden confusion, difficulty understanding, or trouble finding words. You are mid-sentence, and the word you want simply disappears. You understand what someone is saying to you, but your response comes out wrong. Or you suddenly cannot understand words that you have known your entire life. This happens because the language centers of your brain, located in the left hemisphere, are being deprived of blood. This symptom can last only a few minutes, and then clear completely, leaving the person feeling foolish for mentioning it. Those few minutes of confusion are called a transient ischemic attack, a TIA, or a mini-stroke. And a TIA is your brain's emergency flare, a warning that a full stroke may be hours or days away. Never ignore it. Warning sign number 3: sudden vision problems in one or both eyes. Not a gradual blurring. A sudden darkening, like a curtain being pulled across part of your vision, or a sudden loss of vision in one eye, or double vision that appears out of nowhere. This happens because the blood vessels supplying the optic nerve or the visual cortex of the brain are being compromised. Millions of people experience a brief episode of vision loss. It lasts 30 seconds, and then clears, and they tell themselves it was tiredness or eye strain. It was not. It was their brain losing blood supply, and it was a warning. Warning sign number 4: sudden numbness or weakness on one side of your body. One arm suddenly feels heavy. One side of your face droops unexpectedly. One leg gives way without warning. This one-sided weakness is the hallmark warning sign of stroke, because strokes typically affect one hemisphere of the brain, which controls the opposite side of the body. The American Stroke Association teaches people to remember BEFAST: balance loss, eye changes, face drooping, arm weakness, speech difficulty, time to call 911. If you notice any sudden one-sided weakness in your face, arm, or leg, even if it lasts only seconds, this is a neurological emergency. Warning sign number 5: sudden severe dizziness, loss of balance, or difficulty walking. You stand up and the room spins violently. You reach for something and miss completely. You take a step and your leg does not go where your brain told it to. The cerebellum, the part of your brain that controls balance and coordination, is extremely sensitive to reduced blood flow. When a stroke begins in the back of the brain, the cerebellum is affected first, causing sudden, severe imbalance and dizziness. Many people sit back down thinking they stood up too fast. They wait for it to pass. While they wait, the stroke progresses. Now, the 60-minute window that saves lives. On average, nearly 2 million brain cells die every minute a stroke goes untreated. There is a clot-dissolving medication called TPA tissue plasminogen activator that can literally dissolve the clot, causing a stroke, restoring blood flow to the brain, and reversing the damage, but only if administered within 3 to 4.5 hours of the first symptom. After that window closes, the damage becomes permanent. This means the moment you suspect a stroke in yourself or anyone around you, you call 911. You do not drive to the hospital. You do not call your doctor's office. You call 911 because paramedics can begin treatment in the ambulance, and hospitals prepare the stroke team before you even arrive, saving critical minutes of brain tissue. If this video helped you, share it right now. Tape the BEFAST sign somewhere in your home. Teach your family, because a stroke does not warn you twice. Subscribe and hit the bell, because in my next video I am going to reveal the silent disease that is destroying the eyesight of millions of Americans right now. Most people only only find out when the damage is already permanent and it has no pain, no warning, and no obvious symptoms until it is too late.